After hearing some of my stories from the ER, one of my friends asked me if my work was sustainable, like if I would eventually burn out or need to transition to a more chill field of medicine. So I'm entering my 13th year of clinical practice, and I can honestly say that I still absolutely love my job. And I'm convinced that it's got to be one of the most fascinating and enjoyable careers out there. And I mean, don't get me wrong, like sometimes you are put into some hairy situations, and some of those situations are going to be downright terrifying. But I would say that that's much more the exception than the rule. And I'll do my best to explain what a typical day in the ER is like. So I work in downtown Vancouver, which means that I see a mixed bag of people, including affluent professionals, families with young children, students, but I also see a lot of people with mental illness, drug addiction, and homelessness. So not only do I get the privilege of seeing and treating people from all walks of life, we often say that emergency medicine takes the most interesting aspects of every medical and surgical specialty and crams it all into one smelly waiting room. So the best way that I can explain how this plays out on a day-to-day basis is kind of relating it back to my days waiting tables in a busy restaurant. So imagine you seat someone down at a table, you take their drink order, you take it to the bar, then you go to the kitchen, you grab some food for one of your other tables and deliver it, and then one of your colleagues slips and drops a bunch of glasses, you help them clean up that mess. Then you go back to the first table, you take their dinner order, take it to the kitchen, and you seat some new clientele at a new table. You're constantly multitasking, and this is very much the pace and the rhythm that you'll kind of get in an emergency department. And so you're constantly being challenged to adapt to unpredictable situations, which means that no single day in the ER is going to be the same as the previous, which keeps things very interesting. So what I've typically seen is that people end up leaving the profession because of one of three reasons. One, they burn out or they're just not able to handle the intensity anymore. Two is that they become stagnant or they're just not challenging themselves or growing as a clinician. And three is they age out or they retire. So to answer the initial question, I still feel like I'm at a point in my career where I'm going to work and I'm learning and I'm developing more skills and my clinical aptitude's getting better every year. And because of that, I still feel like my best years in emergency medicine are still ahead of me.